computers are down. I can't even see this troponin, and Matt's computer is down. Miss Karen, are you charged?
Yes, I am.
The whole system's down. We can't see anything from my team.
Okay, let's figure out what's going on first. It looks like MedConnect is down. We need to start by placing a ticket and let the supervisors know.
Okay.
Let's review downtime in the emergency department and what you should do if this situation ever arises. Downtime is when hospital center experiences periodic IT/IS application and hardware outages. Certain outages are planned and communicated ahead of time, but there may be times of unplanned outages. Downtime is not considered an internal disaster and does not meet FEM's criteria for diversion. The downtime procedure depends on what system is down. In this scenario, MedConnect is down. At this point, there are 4 key actions. Number 1, have the service associate place a ticket. Number 2, charge must notify ED leaders and supervisors at night and then call ELO. Then communicate with the providers and TLs of the occurrence. 3, have service associates print launch point boards of all teams and RNs to print labs. And number 4, most importantly, remain calm and wait at least 30 minutes to see if the problem can be easily fixed. After 30 minutes and without resolution of the ticket, the service associate and charge nurse will begin the downtime procedures. Communication to TLs and providers is vital. For providers and nursing, this means yellow folders. Charge will coordinate assembling the necessary documents. The yellow folders, extra forms, service associate binders, and downtime dry erase markers are located in the triage cabinet under the printer. The whiteboards for the patient throughput are in the DME closet. Each team has a designated board to track current patients. Orange is for MedSurg, black is for the waiting room, green and blue are for the specified teams, and purple is for faster care. Please support our MedSurg and ICU colleagues with this process, as is likely entirely new for them.
Okay, green team, we need to have a huddle.
When all the supplies are moved into the ED, the charge and TLs will huddle with their team to coordinate. Teams will review what system is down, what the expectations are for each team member. Each patient will receive a yellow folder in the case of a full downtime, such as this example, and identify who is responsible for transcribing the board with active patients already checked in prior to the downtime. Ideally, this is the TL or ED tech. It is crucial we understand everyone's role, but every member of the team is responsible for updating the whiteboard. Without this, we don't have an accurate count and understanding of our patients.
Okay, I just updated the whiteboard with all the green team patients.
It looks great. Matt, I just put in for some orders for our patient Turner. So here's the chart, and I'll go ahead and update the board.
Sounds good. Thank you. I'll get that done.
With the team updating the board with active patients, the triage nurses will continue to triage new patients. They will take a yellow folder for each new patient. Inside this folder is the triage documentation, including the triage note, infectious disease screening, and CSSRS. The triage nurse will then move the patient to the appropriate team and move the folder to the appropriate team's shelf. Remember, MAC 3 and the Gold team will be suspended at this time. To work up a patient, the provider will use the forms in the yellow folder. Each folder comes with a table of contents and downtime instructions to help. Make sure you read these before starting. The forms included in the folder are radiology, lab with a patient label on each form, and all documentation forms, including the bedside order set. Once completed, the provider must hand the form to the nurse directly. The provider and team members must update the board with orders. For extra documents, use the ED Downtimes form binder, which is for each team. This is typically by the service associate desk. Remember, additional labs and radiology will need a new form each time. There is also a binder with discharge instructions. If down to the last form, please copy before use. TL will move the yellow folder to the appropriate spot after updating the board. Pending charts without active orders go to the team chart file. Folders with pending orders can go in the rack next to the TL desk. Discharges will go into the service associate discharge bin, and admissions will be copied by the service associate and transported to the patient location. This video showed the process of initiating and completing a full downtime procedure in the ED. A few tips you should know. Number 1, lab results will be printed out at lab and are available at the window. Please send a team runner to get these results. Critical labs and radiology will be phoned to the provider. 2, for all reads, providers will access Visage if operationable, and reads will be uploaded with an image. 3, radiology departments, including ultrasound and MRI, must be phoned to notify of an order when RadNet is down. This concludes this educational video of downtime procedures in the ED. With questions, please ask your downtime champions and the ED Emergency Task Force Committee. Thank you.